Hi everyone. This is season 5, episode 3 of Love Plans. And I am really excited to be talking today with clinical pharmacist Daphne Berryhill. Daphne is also a colleague and a friend at Those Nerdy Girls, and I am really excited to be here with her. We're going to be talking about why natural doesn't necessarily and doesn't always mean safer and better when it comes to gut health and health in general. So, Daphne, thank you so much for joining me today.
Thank you, Irene. I'm so excited to be here. I love what you're doing. I love the voice that you're putting out there in the gut health space. And of course, you're a fellow Those Nerdy Girls. So my heart's always there too.
Definitely, yes. And I'm excited to dive into all this information. But before we start talking about the science, could you tell us a little bit about yourself, what led you to become a pharmacist, and also why you feel passionate about spreading awareness and talking about science communication on social media?
Sure. Yeah. Why I became a pharmacist. I started out probably by junior high wanting to be a journalist because I loved newspapers and I loved magazines and I loved reading and information. And that was such an important thing to learn facts, to learn and then learn how to sort them out and make sense of them. So that's what I wanted to do. And then during high school, my stepfather developed alcoholic liver disease and almost died my freshman year, and then was terminally ill throughout high school and passed away the month I graduated. And that obviously was a life-changing experience. So from that, there were two things that I shift to healthcare, obviously seeing how important healthcare matters, how it can help. Healthcare gave him those extra 3 years, which were huge for our family. And also thinking about the preventative side of how what he went through could have been prevented. And then also seeing what my mom went through, going through medical bankruptcy, going through the struggling of figuring out how to pay for everything. And so healthcare was an area I wanted to go into because I knew I could find a job. So then I started out becoming a nurse. I worked as a nurse assistant, fell in love with chemistry, and then it was like pharmacy was a natural transition to that. And then it's interesting because in midlife you can come back around to things that you liked before. So when my youngest was in school, instead of going back to work full time as a pharmacist, I'd been working part time. I thought go into writing. I started out writing essays and then moved into health communication. I will say I've gained more respect for science communication as its own specialty. It's not the same. You can know a lot about science, you can know a lot about health. Science communication, health science communication, communicating with the public, that's a whole other thing. And I'm a newbie at it. So I have a lot of respect for the importance of it. The reason why I came into this space is because I think that we're in this moment where it's all divided up. There's not one voice of anything anywhere. In many ways, that's a good thing. In many ways, it's a challenging thing. So it's all hands on deck. We need lots of people having conversations in different places, bringing information, and I like the calmness that you bring, the calmness and clarity and information and humility, but also sticking to the facts as well as what we know and it's what we're learning because things change and evolve. And so I thought it's a good place for people, everyone to come in and to support. I think it's great to see more pharmacists entering this space. I think we need more pharmacists, but we also all don't have to do the same thing. We can support people, we can find little groups where we can have conversations and then expand and build bridges.
Yeah. Yeah. Oh, I love everything that you say. And it really resonates because that's exactly how I see science communication. There is a long road ahead, but what we also see with Those Nerdy Girls is that we need all the voices and different kinds of voices because people connect with how you tell the story and how you talk about the evidence in different ways, right? We each have a part to play if we want to do this in science communication. And let me just say that Daphne writes so well. And I'm going to put all the links in the caption and we'll talk about the things that you write about and that you talk about towards the end of this conversation for sure. So now to our topic. So we say natural. What do people generally think when they say something is natural for gut health?
So I think if they're talking about taking something, it would mean something that's not a medication and that's sold over the counter as not a medication, so it doesn't have a drug facts label. If they're talking about doing something, it would be something that's not a medical intervention and something that's not just standard like you would normally do. But that being said, I think it's a very sensitive word. It can mean lots of different things. So when it comes to one person, it's best not to assume anything and to listen to find out what it means for them. And sometimes these things can be sensitive and they could have lots of stories of things that affected them, and it could mean lots of different things. So I think it's very important when we're talking with people to meet them where they're at and to learn what it means, because and not assume anything.
Yeah, and to ask questions, like you said. So, on the flip side, from your perspective as a pharmacist, what's the biggest misconception when it comes to how people perceive this word natural? And what are some things that you would like to point out?
Natural has no medical exact meaning. There's no standard definition to what it means. Natural also has huge cultural implications to it, and it's evolving. So, what counted as natural at one point and how it was framed. So, for my mom, natural growing up without any running water and natural natural can be hard too. And her second son was sent home to let nature take its course. Her son was born, my brother with spina bifida. So in that case, natural to her was like not, you wouldn't think of natural is not always a good thing. Some people can see different things that we've heard about happening with forever chemicals and all these different things. Like you said, this was safe, now it's not safe. Or you had something personally happen to you. And then natural can mean, can really change how you feel. I felt all different ways about the word. It means a lot. In terms of gut health, the biggest misconception would probably be that the microbiome science is at a point where we can give a pill for something for general health or for something specific, and that we have some kind of confidence that it's going to do something good or we know what it will do. And I think that we're not at a point, we're just not at the point. And I'm not saying this, I'm not an expert about this. This is speaking with gastroenterologists and other people, and you are the expert more than I. You know a lot about this, so I love learning from you. But just from my take as a pharmacist, from what I see, is that it's not. The jury is still out. Some will say it's not ready for prime time, but we just don't have the information to put it into a pill to give to people to have an effect or a benefit. And so that's then a misconception. And then I would also say sometimes people think that maybe people working in traditional medicine, I work in a traditional healthcare setting, and people think that they wouldn't want to give people natural remedies. But in my experience, providers, if there was such as a natural remedy or something that you can do as a supportive measure, or if you really that made sense for whatever type of condition you had, yeah, oh gosh, they would be on board. And sometimes we do have things like that, like peppermint oil can help with IBS. We have some situations where we have evidence, and I don't see anyone that would want to hold it back from someone, but we need to have enough evidence to say, if we're going to recommend something, to say we have evidence to say that it works or that it might work. And there are levels. It's never, most things are not this or that. They're somewhere in the middle, and we're all navigating it in real time, and it's changing.
Yeah, oh, no, absolutely. And I love what you said about the gut microbiome because, yes, we do know a lot, but it's just such a huge field and we're just not there yet. And it's just that understanding that basically for science to then come with recommendations in clinical applications, we need to have the evidence to support that. And sometimes a lot of these natural supplements or remedies that are out there might have potential, but we just don't have the evidence to support it yet, right? Specifically, let's say probiotics and some herbal supplements for gut health. Should people assume that they're always beneficial? Can we discuss this a little bit as examples?
Yeah. So I would say most leading experts in these areas say there's no general benefit that we know of to just take a probiotic. Most of them, they're not doing it themselves. They're not recommending it to people to just take one every day. It seemed like it's shifted. There was more promise some years ago that this was, but then as we have more studies and more studies, it doesn't really seem like there's there, at least not in the way that we think. Now, when you went back to evidence and you're talking about where we're at, putting something in a pill and giving it as a supplement is one thing. Eating foods, doing other things and habits that we know are going to be good for lots of different reasons, that's different because we know there are benefits, period. So this might be another benefit as well. So I think that's different. But when it comes to giving a supplement to someone, recommending a supplement, No, there's only certain situations when it would be recommended, and it's a more of a weak recommendation based on sometimes mixed or limited evidence, not a clear, this is definitely something to do. That would be if you're taking antibiotics, diarrhea, some IBS, but that's still mixed there. C. diff prevention, gastroenteritis, like the stomach flu, situations like that. And I don't think that if someone was wanting to take it, that generally for most people, if you're not immunocompromised, if you don't have something, a serious health condition or a short bowel syndrome, or that young children and infants, preemies should not be taking probiotics. Everyone should just talk with their clinician first, but I guess the feeling is it's probably safe and it might do something in some situations, but there's no reason to generally recommend it. And if you're taking antibiotics, like I've heard sometimes people will say, sure, take it. You can start it when you take it for a week to up to 3 weeks after. But again, in this situation, and a lot of people don't realize too, it's not just take a probiotic like it's one thing. It's like there's the genus, the species, and sorry, hold on one second, just wanting to just make sure I say that. Okay. The genus, the species, the strain. And so you have to have, if you're going to look at one that has some evidence to support it, you want to make sure you're taking the exact one that the evidence was tested to show. And then the CFUs, you want to make sure that it has the right amount. And so it's just like you would a medication, right? If you're taking a medication, you would want to know what exactly is it, and then try to stick with a reputable brand. Those would be some just common sense recommendations, but there's no strong evidence. And I'm not seeing personally, I don't take a probiotic, but I think the food types of things are so important because there's lots of different benefits. And I think the story of the probiotics, it follows a lot of supplement stories. At first, there's information like, oh, there's this reason to take it. It makes sense. We hear, oh, people that have this different imbalance are more likely to have this outcome. So maybe we can give something to fix something. We'll see these, and then maybe we'll have some early promising things. And as we get more, it turns out to not be so great. A lot of supplements follow that. It doesn't mean, you know, they have no benefit. Most of these are just not that important. And when you're looking at the big picture of health, it's not something that is going to make a difference. Just diet, the things that you're eating every day, all of those, sleeping, moving your body, just the basic types of things are going to matter the most, are going to have the biggest impact. And then so much gets focused on this because there's a lot of marketing around it. And it's understandable. I'm very sympathetic for anyone wanting to find something to feel better. And natural does have a feeling, it's gentler. And I like that idea. So I understand that.
Yeah. And sometimes gentler, and sometimes people assume that it's harmless because it's natural, but not necessarily everything in nature. Like you said at the beginning, not everything in nature is harmless. And I guess also we should say that the supplement world doesn't go through the same testing and regulatory process that the medication does. So you also have that unknown in that respect there. And
Yeah.
that's for sure, because I'm also like you. I understand, and we're human, and we all, if you have issues, you want to try different things, but it's also good to bear in mind that what does the evidence support? And also the next step is, can they interact with medication? Can they actually have a negative effect instead of just no effect? Would the worst case scenario perhaps be that it would have a negative effect? So from your perspective as a pharmacist, what would you say? Could they interact with medication, supplements, for example?
So the probiotics themselves, we're not that worried about. And chances are, most of the time, some people compare it to, in terms of what's going to happen in the gut, is cracking your window open just a tiny bit. So the concern isn't necessarily the probiotics. The concern is more contamination, that it could have other things in it, or the concern that someone would have if you have a weakened immune system or you have some other type of thing going on, that can be a concern. But just general concerns. But a lot of these gut health supplements they contain lots of things. Sometimes they're like kitchen sink products. They're just like toss everything in so they can put more things on the labels. It's actually really It's upsetting to read the labels and to see the marketing around it. And that all in the United States stems back to 1994 when they decided to not regulate supplements the same way as medications. With many things, this was political. I'm old enough to remember this. I was a voter at that time. And it's unfortunate because we deserve to have information about if we're putting something in our body, we're taking a product, we're getting it, we deserve to have information about it, and we deserve to know what's in it and that it's been tested. And even with medications, we still need to keep pushing for standards and keep getting better on those things as well. Medications are not perfect either. We're constantly trying to improve it. But with supplements, you don't even have the basic types of testing done. And when it comes out on the product, it's really just looking for maybe reports. So when it comes to interactions, it wouldn't necessarily be the probiotics, but they have oftentimes have other things that would be in it. And so we as pharmacists will look, and we really love when people share all the information when they check with us first before taking something, and when they share all their medications and supplements, anything with us that we can add to their list so we can check them for interactions. It's really important, especially if you have any health conditions or if you're taking any critical medications. And then we have a natural med database. We can look at for interactions in there. A lot of times the interaction potential is possibly theoretic, like this might, based on what we know about this ingredient and the medication. Sometimes there is some evidence. It might only be like lab-based evidence. Sometimes we have reports of something. But the absence of information doesn't mean it's safe either. It doesn't mean we're not actually testing all of these. And even with medications, after something comes out on the market, we can still learn more about interactions. So we look at that, and then we would share that information. So we need to have the product know all the ingredients in it, check all the ingredients, see, is there something known? And the interaction could happen anywhere. It could happen in the gut. It could change how medication is absorbed. And sometimes you need to space things. If you're taking an iron supplement, you need to space it from some medications. Sometimes it can change. There's some like St. John's wort that can change how your liver enzymes and can impact the drug levels of other medications. Sometimes it can affect kidney or how quickly a medication is excreted from the body, or it can exaggerate or offset beneficial impacts that you are trying to get from your medication that could change. So there's lots of ways interactions can happen, even more beyond that. And it's always good to check before you take something and anytime you make a change. Just check. And we're always happy to share information. But it's really just best to think of a supplement. Anytime you're taking something that's a product and you're putting it in your body like that, I think of it all as medicines. It's all the same. How it gets classified is more of just a political legal thing, but not really something that has a health reason for it. It's arbitrary.
Yeah. Yeah, that's a great way to think of it. It's still, if you consider it as medicine, that it should have a dose and might have side effects and interactions. And also before you start, talk to your clinician, your healthcare team to see if it's right for you, for your condition. And also we hear, obviously through social media, we hear so many stories, and just because something worked on someone doesn't mean that it's going to work for me. Just like my IBS journey is going to be completely different to someone else's IBS, even though we both have the same syndrome, right? So it's
Yeah,
important.
that's so true. And I like patient stories and people sharing information. It can be really helpful when it's just an openness kind of thing and you're just talking about things. But you always have to consider on social media, you have to be very careful, because a lot of the people that just look like they're sharing stories, they're actually being paid. They're brand ambassadors. So they're not just it's marketing information. It is not just someone sharing their story. If someone is just sharing their story with these, they can be nice things to hear about. It can make you feel less alone. And if it's someone especially if it's just, oh, I tried this and this helped. That's human nature. We've always done that. You're talking in a group of people and you're like, oh, I've been feeling this. And there's nothing wrong with that. I don't think that's necessarily a bad thing, but we should be careful when it comes to buying a product or something, take a medication. That's the one thing that you do learn in just working in healthcare, and you learn how everything is so specific for a patient, which makes it difficult to have these conversations at large public levels, because we'll say one thing and then some person might hear that will be like, wait, that's not what my clinician told me, or that wasn't what my experience. And it's because it is complicated. And even when we have guidelines, the guidelines are not just set in stone. Most of them, guidelines are actually becoming more, leaving more wiggle room for clinicians with patients through shared decision making, taking into account individual differences and, of course, patient preferences, because it's your body and we respect that, and your decision. So yeah, so you have to look at that. The other thing I would add is that the placebo effect is big. You can see this in studies when you see the placebo group and you see the other group. It can be a good thing. Like, you can use the placebo effect. Maybe there are different ways. If you're doing something that's totally safe and you think it's from that, and maybe it was, or maybe it was a placebo effect, who cares? But if you're putting, again, if you're putting something in your body that could possibly have risk, then that's different. Then you need to know, we don't want to do something. We don't want to just do that if it's just based on placebo effect alone. And if you are doing that as a clinician, you need to be honest and transparent about that, because there's a long history of people not having information. So we share information. Also, when you're talking about IBS, and I would put this with like menopause, perimenopause, with so many of the top talked about conditions that you'll see on social media, there are things that can just fluctuate and come and go on their own. It can be really difficult to know why, oh, I started doing this, now I feel this. Maybe it would have happened on its own, maybe it wouldn't. It's difficult to know. So if someone, they're being very, like, they're sharing their information, and it's not, you're certainly not saying like they're being honest, they're like really believes it, but you just know that there's lots of other things that could be going on. It might not apply to you. And just meet a person where they're at, listen to their experience if you're wanting to. And if you need space, take it. So I know certain times, and I know people that are going through difficult diagnoses, or I know when I was pregnant, I didn't want to have any information for a while except for my clinician, and very limited from sources I knew I could trust. If you're in a sensitive place, sometimes it's okay to just step away from it. You don't need, it's not going to add to it. And hearing another person's experience can even make you feel badly. So it's okay to do that. It's okay to just be like, I need some space. I'm figuring this out. This is really hard for me. And I don't need more things coming in my head. We have too much coming into our heads.
Definitely, yes. And if you need to take a step back, yes, it's good to have these conversations with your healthcare team for sure.
Yeah,
Yeah.
and that really there to be partners, and to give you, to really feel that confidence, and to feel that you have options, you have support. It is a scary feeling. And I think that's part of also what we're seeing is a lot of people I've seen, there's been a breakdown of a patient clinician relationship, in part because our healthcare system, a lot of people don't have access. It's very difficult to get into providers. There's a lot of turnover. And I think that is a really important focus, is to find ways in healthcare to rebuild that, to find ways to reestablish those relationships, because I think those are so important. I Things I've been through just in my own experience, when I feel like it's a clinician and I've talked to them before, and then I see them, then I see them the next time, and you have a little bit of that kind of trust built up. It alone can really, it's calming. It really helps, and it can help if you're going through something difficult and you don't have that. It can make your whole condition worse if you don't have that, if you don't feel, or you're going into an environment where you don't feel that you can trust what people are telling you. And I think that all of these things, of course, it's so interesting too, because I think people have always known the mind body connection, but it's so strange to think of how we have mental health as a separate thing. And that's a big problem, I think, in healthcare as well. And there are some collaborative models to bring more help, like therapists and mental health support within just primary care, because it's all connected, it's all together. And we're figuring out ways and trying to find more ways to make things better.
Definitely. And there's, all this, the focus on natural, and there is also, you see again, this narrative on social media about fear of chemicals, right? An excessive fear of chemicals. Oftentimes you'll hear people say, oh, if you can't pronounce something, you shouldn't be eating it, which really doesn't make sense, because there's all these natural things everything is made of chemicals, correct? But I wanted us to just chat a little bit about this idea of this excessive fear, chemophobia, and how that can impact people's relationship with food and gut health in general.
When you were bringing up the ingredients and you can pronounce it, I'm old enough to remember the Breyers commercials of the 1980s, and there would be like the cute little girl and she's reading the ingredients, and in that brand, oh, she can read all the ingredients and they make sense. I think that I felt I've seen so many different shifts through what people even think of the word chemical. If you go back to the 1960s and 70s, like sometimes synthetic at first was thought of synthetic was better. That's the better stuff. So when my mom, they needed food assistance and they would give the lard and the whole grain to people that were needy, and that was not considered as good. And then it would be like the Crisco, the hydrogenated, all the processed white breads, that was cleaner and better. And so natural it changes all the time of what it means. But I think ultimately, so it's a phobia. Phobia is about trust. And I do understand, I can really relate. I feel like people do have a right to feel hopping mad about lots of things. Like I can relate to a lot of those things. I remember in the 2000s and with the BPA, and you're a mom, you've got kids, and you're like, oh my gosh, there's all these chemicals that are in a baby toy or something like that. It's really, you feel there's a sense of violation, and it's upsetting. And then and so once you have that, then once you have people feeling fear, there's going to be people on the other side that to take advantage of it and then be like, well, you shouldn't trust this, and then you shouldn't trust that. And then I don't know what I can trust anymore. So the people the people that are just like regular people trying to figure things out, we need to really have a lot of sympathy for understanding of that feeling of how do you balance these things, because we hear mixed messages all of the time. It's hard to know. You hear something is good and now it's not. And it's the chemophobia, it's like you can't see them. Oh, and then they can linger. They can stay in my body and never leave. It's a scary thing. I get that. And so I would say that at the same time, it's like, okay, I'll come back. Okay, Daphne, I talk to myself, put it into perspective, and then I'll think about all the different ways medications have helped. My mom, I remember she had mastitis. Antibiotics saved her life. All different times I've had different things. Would we have this many people on earth being able to feed everyone if we didn't have different synthetic processes? And then I think, wait a minute, people had a lot of health problems before. My grandma lost all of her teeth at 28. People weren't all these healthy, happy people before. So then I put it into perspective, and then I look at the big picture. And I think we all kind of need to help each other walk through these things, to walk through the risks, and also be sensitive that there's certain times people will feel more sensitive. So I'm 51 now. I feel more calm about worrying about chemical kind of stuff. But after I lost a baby, when I was trying to get pregnant, when you have little kids and they're putting everything in their mouth, it's like I felt more anxious about it and things like that. With some of the vaccine worry I saw in La Leche groups with moms that had gone through different childbirth experiences and didn't feel respected, and then felt like they felt betrayed in some ways by different things in the system. So then you start seeing these things, but then it kind of comes back to that clinician person of having, and this is why it's so important to have the context of having someone to help you walk through these decisions with risks of looking at it. And when you have a phobia, you need help sorting things out. We need support. We need that. We need someone we can talk to that, oh, this person is on my side. They will also respect how I feel, but they'll point out some different things and give me some insight on it. We need more of that. And this is a complicated, sorry for going on and on, but it's really complicated. And there are layers to all of these things. So I think coming back way, way back to it is what the harm that it could happen. So there are one harm would be that you are maybe drawn away from traditional healthcare and you're having an issue and you're seeking information and you're avoiding you're avoiding medical care that could help, avoiding screening, getting diagnosed late, not taking a medication in a timely way when it could make a difference. That's a risk. You could expose yourself to something natural. And of course, as we said, like natural, we have in oncology, I'm in oncology. We have lots of naturally derived chemotherapy. Arsenic is something that's naturally found that we can use. Natural does not mean safe, but if you're taking different supplements, buying different things, you could expose yourself to risk. There have been people harmed, liver risks from some liver toxicity, other types of things. There have been things that happen, and even just microbial contaminants. And sometimes things might happen we don't even know. We will never actually be able to know what caused what. So you're opening yourself up to harms. You might keep yourself from needed timely medication. And then the other thing that we probably don't talk about enough is just the anxiety and time. What is the opportunity cost? How much time are you spending thinking about this, and money and focus, and what is it taking you away from? And then how is that influencing the other people in your life? And I've thought about this more. My oldest will be 26. And then I have a 20-year-old, and then I have younger kids. My daughter has told me, she's called me out as almond mom-ish during my days, because I was like the mom that didn't want her to have the Lunchables and was like the mom that the kids would make fun of. And and I've rethought a lot of things learning from her, because it if you get so worried about stuff, it can cause eating issues, it can cause anxiety, or it can go the other way. Like my son, he just tunes me out. So I think that somewhere in the middle of finding some kind of balance is good. And we need people to help us talk through things. And if you're feeling like chemophobia, or you're feeling worried about stuff, that's okay. It's understandable why people feel that way. Lots of people feel that way. I've felt that way. I can feel that way. And let's just talk about it. And then trying to step back sometimes to look at that big picture, just really, and how do you want to live your life? How do you want to spend your time? Where do you want your focus to be? And we already know it. We know, we have enough research to know. We can even probably go back to our grandparents to talk about, like, the real thing, the most important things that matter are just the balance, the social connections, getting outside, getting some fresh air. If you're eating lots of different colors. I love all the recipes you share, doing those things. And then the regular just check-ins with your clinician for screenings and things like that. Those are if you do that, it's like, that's great. And don't stress so much about everything else. And washing your hands, like, that's a really great thing. Wash your hands before you eat.
Important steps. Some of them are the boring stuff that we hear all the time being said, but that's exactly what works. And I really appreciate your empathy and kindness, and how you see where everybody's coming from and what kind of issues these can cause. And I think it's an important message also for us as science communicators, right? The way we communicate all this, to show the understanding and to focus on small changes, and again, what the science supports and what doesn't. Sure.
And when my experience, clinicians, if someone comes in, they bring this supplement in, they say they want to take it, they'll talk them through. But it's also, there's respect. If someone is wanting to take it, they're not going to, unless there's something really clear and worrisome and stuff. You can talk with your clinician, and we're not like, oh my gosh, no, you can't ever do this. Don't ever take something unless it's absolutely proven. Like, we will work with people. We provide the information. Ultimately, it's for people to decide. And then we respect people's decision. And so that's important. And I think and even if you have teenagers, once you have teenagers, you need to have that, you just need to have that openness. And it's also important as clinicians, I see this much less now, but in the past, there was this hubris, talking to people, like telling people this or that, and not as much. We've moved to more shared decision making and conversations. But just be aware of when someone's giving you information, what are their motives? And that's really important, because there's a lot out there. And oh my gosh, I will say I've fallen into one of those things a little bit. Some years back, when I started listening to podcasts, it's like you listen to it. And it's tricky too, because a lot of the influencers, sometimes it's great information. You know what? Like 80%, 95% is really great information. And then there's something there that is like, why are you saying that? And then you really do need to look at, like, why are they there, and where are they making money? How are they getting funded? Look at those kind of things. And it's always good to ask questions, and you should ask questions of clinicians, and we should ask, you deserve information. You deserve to ask questions and know where your information is coming from.
Yeah, that's fantastic. I wanted to focus on this for the end of our conversation. If people are looking for tools and skills to determine if something is evidence-based or supported by evidence, basically, and not just for marketing, like what are some things they can do? And you've said, discuss with your clinician, listen, question things that you hear. I guess look what other medical organizations are saying as far as what your questions are. Anything else that you would like to add?
Yeah, I think all of those things are good. I would say just don't even think of it like evidence-based is there's a gradient. There's some things that we definitely know there's some are totally not safe. There's some things that we know is very important to do. A lot of things are somewhere in the middle, and there are levels of it. Some are strong recommendations, some are weak. Looking at the different organizations, basically, if it's something from someone who sells supplements, someone who makes supplements, that information is marketing. So I would not, and they might be citing a study, but they might only be selective. It's an older study when we have new information. So I would completely not ignore that. If anything, you're going to take that information, I would just take it as if they sound so confident or so whatever, that would be a sign to maybe a sign of caution. But don't take any information, don't learn about evidence from someone selling a supplement or someone making a supplement. And then it's really looking at multiple sources and multiple people and who is the person, looking at some organizations. If you're going on AI, you're asking questions, follow some of the sources, see what they are. If you are going to a site, you want to know when it was written, who was it written by, was it reviewed, when was it last updated, what sources are used. And those things are really important. A lot of information out there is old and a lot of things that AI is picking up, it's not even updated. And sometimes the guidelines are not updated. And so clinicians will know that as well. And the guidelines are also their guidelines. So they're not meant to just be like, oh, you do this, you do that. Earlier algorithms were a little bit like that. And once in a while, there are conditions that are so straightforward like that. Most of the time, not. And so it's really best if you can find a primary care clinician, have someone that you could ask would be the absolute best. I know that's really hard, but I think that that's the most important thing. And then looking at multiple different types of sources, and either when we look at evidence, it's never one study. We are not going to take something that, if it's like a life-threatening cancer and you've done all these different things, and okay, if you're just taking something for general health or to just manage a condition, we're looking for evidence. We're looking for a study, but then a quality study. And Those Nerdy Girls is a great resource for information, learning about how to look at a study. And I think it's really good to have that science literacy basic of looking, how was the study designed? Who was included? Who was excluded? How long did it last? Most of the time, these studies are not very long. They're low quality. Sometimes there's no placebo. Sometimes there's no standard of care either, which is important because if you're choosing to do this instead of something that we have medications for, you want to be able to compare it to something that would work maybe much better or something, or cause fewer side effects. And a lot of times there's mixed. That's the problem with a lot of these. I wrote a lot of articles about supplements. They're not even fun to write because half the time you're looking at the information. It's okay, this animal studies, this was like some college students, or it lasted 4 weeks or 8 weeks, or sometimes they are not even clear of the dose that was used. Some of them are really low quality, but even when you have high quality, sometimes you'll have one study one way, you'll see another study, it says something different. If it were clear and if it was something that really worked, you would see some kind of consistent pattern. So that's what people are looking at. They're looking at that bigger picture of something. And if it's something that's a supplement that's been around for a long time and we still haven't found it's probably because it's not there, at least in the way that it's being used.
Yeah, makes a lot of sense. And sometimes if it's just an animal study, then there's a long way to go before we have clinically relevant data to support that. So it's all sorts of different things. It's the big picture for sure. These are fantastic tools, and we can link to some of the articles from those Nerdy Girls too on data literacy, because it's so important. I think it's good for all of us to feel that we are somehow empowered to make decisions by understanding the science, understanding how some studies, what it means to have enough clinical evidence and how a well-designed study is and so forth. Yeah,
And it
definitely.
could be simplified. It really is a lot of these things. I think people, if you look at kids, I think we're born scientists. We're born to think in those ways, figuring things out. And so those nerdy girls, yeah, breaking some things down, giving you some of the language so you can just look things over. And it's another layer, then another layer. The more layers that we have like that with understanding, the better and safer we all are.
Yeah, for sure. Thank you. This is all so important. A lot of information to unpack for sure in this conversation. But like I said before, you're doing a fantastic job with everything that you write and you do a lot of things. Can you tell people where they can find you on social media and where you've published things so that they can learn more about you? And I'm definitely going to put the bio in the caption and links to your accounts as well.
Yeah. So I am an oncology infusion pharmacist, and then I freelance, write, review, develop content, continuing education and consumer facing health reporting, and then personal essays. So you can find me on LinkedIn. My website is my name.com. And then obviously, I'm on Instagram, but not a lot. I'm on Facebook, but not a lot. I'm in my head mostly, and then around my kids and doing stuff. But I do think it's important. I think it's important to be out there. And as a pharmacist, I'm really trying to get myself in meaningful ways and find ways to make those connections. And I really encourage a lot of other clinicians and pharmacists, and those nerdy girls was so welcoming. When I was expanding out just from writing and wanting to connect, and it really helped build my confidence in, that I can help contribute to the conversation. So yeah, you can find me any of those places, and I'm always happy to connect.
Great. Thank you, Daphne. And before we finish, I want to ask you the last question, which is basically doesn't have to do with supplements or probiotics, etc., but it has to do with chemicals. It has to do with food. And my question is, what is your favorite plant-based food or ingredient or a recipe that you would like to share with us today?
Yeah. Okay. Who does? I have lots of different recipes, but I'll just bring up this one because my daughter is getting married in September. So I'm like doing the wedding shower planning, and we're doing the recipe cards to send out and then bring recipe cards back, which is it's such a great way and to have just recipes that other people, I love sharing of recipes. It's so fun. And so I have the little recipe card. So I'm about to write this one. I'm trying to get this filled out. And these are toffee bars. This is like,
Oh,
remember these old cookbooks? Oh, sorry.
oh
Yeah.
yes.
Yeah. So it's like toffee
Very
bar
nice.
recipe that my mom used to make when I was little. And it was, oh my gosh, I haven't had these in years, but I'm making them for Easter. And it's a really fun, exciting thing because my younger two kids can now eat walnuts. They got the green light. We have a lot of nut allergies in my family. And so it's such a simple recipe. A cup of butter, a cup of brown sugar, a teaspoon of vanilla, 2 cups flour, and then you have a cup of semi-sweet chocolate chips and a cup of chopped walnuts. Bake 350, 15 to 18 minutes, simple. And it's just, so what I love about this is sometimes, okay, it's just the butter, the brown sugar, and the walnuts. It's the richness of it, it's the sweetness of it, and it's also just the calories. And I think also it's really important when it comes to food. It's just really remembering how fortunate we are to have food to eat. And so it's like we can worry about all these different things and the joy of the food and the memories of it. So that was the first. I'm going to write a bunch of these for my daughter, but that's one of the first ones I was going to write. So I thought I would share that.
Great. Maybe we'll share it in the caption as well
Yeah.
for sure. And in your daughter's honor as well for her wedding. But yes, thank you for sharing. And yes, food is memories, and it's so important to embrace it, even when someone might suffer from gut health issues and all sorts of other conditions, of course, but we should try to enjoy food and build memories around it for sure. Yes.
Yes.
Thank you for sharing this. Thank you, Daphne, for everything that you shared with us today. It's a pleasure.
Thank you, Irini. This was so great. Take care.
Yeah, bye.
Bye bye.